I hope I'm audible to each one of you.
Yes.
Yes, ma'am. Okay, so for today's session, we have with us Dr. Hemal Patel, who is working as an assistant professor at our institute itself, that is Ashok and Rita Patel Institute of Physiotherapy, CHARUSAT. Sir has been with CHARUSAT for since last 8 years. Sir has done his bachelor's in physiotherapy from Rajiv Gandhi University, Bangalore. And Sir has done his Master's of Physiotherapy in Musculoskeletal Sciences from Ashok and Rita Patel Institute of Physiotherapy. And Sir is currently pursuing PhD here itself. Sir is a registered lifetime member of the Indian Association of Physiotherapy and the Federation of Indian Manual Therapists. He also has a teaching experience and research experience since last 8 years. Sir has guided 9 UG product projects and 7 PG projects till now. And his research areas are mainly the areas of development of normative values, knee osteoarthritis, development of the new medical devices, and along with that, back pain. Sir has 5 of his research articles published related to those areas too. And Sir has presented various papers at national and international conferences. Sir has received various awards, including the Young Innovator Award by InnoHealth, IMSC Young Researcher Award, and also IMSC Research Excellence Award. Sir has also been granted a patent for development of a weight distribution analysis device. So today, Sir is with us, and Sir is going to give us an insight on the topic of understanding medical terminology. So we welcome you, sir, and we'll be hearing from you next. Over to you.
Thank you so much, Shreya ma'am, for your kind words and nice introduction. So now we'll begin with the today's session. So I'm just sharing my screen. Okay, all of you able to see the screen?
Yes, sir.
Yeah. Okay. So today's topic is like medical terminology. So before that, I just want to know from your side that what exactly you mean by medical terminology, right? So can anyone tell me about what you mean by medical terminology? Don't worry, I'm not taking your exam, but just I want to know your perception regarding the medical terminology. Anyone? Yes, Netra. You can type in chat box also, no issue. Term which are used in medical field, yes. Thank you. Here. Anyone? Priyansi Thakkar. It's basically how to describe the human body. Yes, Archie. Scientific terms. Yes. Thank you. Now just understand here itself in a title, like we need to understand lots of things. For example, medical, that means we know that medical by means related to the human body or the field which is related to the medicine, right? So it is called as a medical. Terminology, logy, right? Again, it's a major word to need to understand. Logy by means to study of very specific terms, right? It's called as a logy. Like for example, we have a subjects like physiology, right? The study of physiology, right? Then human anatomy, like other subjects, like the subject which is related to the deep knowledge of understanding, it's called as a logy. Biology, right? Related to the bio, it's called as a biology. Likewise, there are many medical terms are available in the medical field that we need to understand when we are like beginning our medical journey, because again, without understanding of this word, I think it is little bit difficult to understand what exactly we are learning, right? So in this current webinar, right, we are more focusing on what is medical terminology. Then second, we need to understand why we need to learn, or what is the purpose of learning of medical terminology. Then what are the different terms that generally we use in medically in a routine practice, like from doctor to doctor, doctor to nurse, and likewise. And then at the end, we will discuss certain examples related to this, right? So yes, definitely before starting, I like always said that not learning is always important, but along with the fun plus learning is the best way to express the education, right? So we'll do certain tasks in between also. And if you have any doubts in between, you can either like unmute yourself and ask me, or you can put your question in your chat box as well, right? Okay. So I'll just start this video and I'll ask anyone to translate whatever this person right said in this video. You have to translate in a local language or in a English.
同志们、朋友们、女士们、先生们，大家好！岁月不居，时节如流。2019年马上就要到了，我在北京向大家致以新年的美好祝福。2018年，我们过得很充实。 走得很坚定。这一年，我们战胜各种风险挑战，推动经济高质量发展。
Okay, can anyone tell me what he said exactly? Anyone? Patel? Money? Anyone tell me what exactly he said about anything? Time goes fast about the year. As time passes, we need to accept the situation, season changes. You understand because the subtitles are available. Otherwise, you cannot able to understand. Why you are not understand? Just because you are not aware about that words, that terminology, because it's a different language. Similar in nature, the medical language is completely different generally that we use in our day-to-day life, right? So what is medical terminology? So yes, it's a special vocabulary. Generally, all the medical persons use that specific words to describe those type of scenario or those type of situation as well, right? So it is very specific. Plus this all vocabulary mainly based on the Greek or the Latin words, right? So if you translate those words in a to better understand, that word derived from Greek or the Latin words, right? And they have very specific meaning related to the body or the medical field. Again, one of the important point is it is a consistent and uniform throughout the world. So whether you are practicing in India, whether you practice in US, Canada, Australia, the meaning of that terminology will be same because it's a consistent and the uniform throughout the world. So this will help to reduce the misconcept, misunderstanding, like, and many other things. And that's why it's a uniform in nature. For example, if you say that you have a hepatitis, that means the meaning which is in India and US will be same. If you're talking about the inflammatory condition like osteoarthritis, that is a meaning related to the osteo, and arthritis means inflammation of bones and the cartilage, right? So that meaning will be same throughout the world, right? And that is most important things in a doctorate line. For example, if somebody is like admitted in USA and that patient is referred in India along with all the medical reports, sometimes it is difficult to understand if the word or the terminology is not uniform in nature, right? So whatever the documentation or the things that we need to do in a proper terminology which is related to the medical. Again, it is also an efficient, right? So it reduces your problems it reduce your work time and likewise, right? So it is also important to use the medical terminology throughout your medical practice. Often reduce the entire phrase or two single words, right? So many times we don't need to write down the full sentence or the word, right? And rather than we just use the simple terms. Like for example, most of the time we are not like writing the, for example, ECG, right? So ECG generally we all aware about, but we never write down the electromyography and likewise, right? So similar, there are many words, right, which are not writing in a full terms, right? So in that we use the abbreviations. So again, it will save your time to prepare your reports, notes, and likewise, right? So again, it will reduce the time as well, right, to prepare your notes and likewise. There are methods that can help in learning and remembering the words. Method by means you should understand the different phases of words, like, and that phase of words have the similar in context with the understanding and the remembering of the words. So what are they? Right? For example, in purpose of medical terminology, why we need to learn? So they use for the effective and accurate communication from the medical person to person. Even it will help to note down the notes along with the certain forms and the discharge summary, even the informed consent form, and likewise, right? Even maximum times, right? If you take the X-ray, MRI, or any diagnostic report, right? So most of the time they use the medical terminology to prepare that type of reports, right? So again, it will help into communication and preparing of reports from the effective and accurate way. Next is your helping in making the informed guess regarding the meaning of the unifamiliarity words, right? So as I told you previously that all the words are uniform across the world. To save the time in hospital and clinic, because every person in hospital, doctors, nurses, radiologists, and everyone are quite busy. So they use this medical terminology to save the time and the efficiency as well. Easy to documentation, it's very easy if we use appropriate word, right, at the right time and right choice. Then preparing a medical record. So there are various type of medical records in hospitals and clinic, right? So to prepare all the medical records, right, we need to understand the medical terminology. Now, this is one of the important part to understand the medical terminology. And if you understand this one, it will be very easy for you, right, to understand any words, right? So most of the time in any word, right, either there are some prefix, definitely there will be a root word, and there will be some prefix, and along with that there will be combining forms, right? So we need to just understand this four terminology, right, to understand the word itself. For example, prefix is nothing but the short word that part the added before the root word, right, or the root to modify its meaning, right? So anything which is before the root word, it's called as a prefix. After any root words, it's called as a suffix. So suffix is nothing but the short word part or the series of part added at the end of the root to modify its meaning. It's called as a suffix, right? So prefix, again in prefix itself is said that pre means always first, right? So it is called as a prefix. And the root is the one of the fundamental unit of each medical word. It's called as a root. So the root will be on a heart of that word, right? It's called as a heart of that word. If single root is there, there will be a different meaning. But when you added the prefix before the root, it changed the meaning. If you added the suffix after the root word, it changed the meaning. So root meaning will be changed according to the prefix and suffix, or it's a single only root, right? So the meaning will be a different. So that is called as a prefix, root, and the suffix. Yes, in single medical term, there will be a more than one root as well, right? So it is not necessary that in single words, only one root word is there. But along with that, there will be a multiple word or the root will be there in a single word, right? That is called as a root. There will be a combining form. Now, what do you mean by combining form? A combining is a vowel may be added between the root and the suffix. And that is again depend upon the rules, right? There are certain rules to add it with the combining words like vowels A, E, I, O, U. There are certain vowels that we can use to combining or to join the prefix and the root or the suffix and the root, right? So now we'll see in a detail. Right, yes. So the ultimate, you can see over here, right? So this is the formation of any word, right? Formation of any word. So the between is always on a root. Before it is called as a prefix. After if it is added, it is called as a suffix. So if single word, quite chances that prefix, root or suffix or a prefix and root. There will be three combinations, right? Either in a single word, it might be a prefix, root or suffix, right? Or it will be prefix and root only, or it will be a root and the suffix only. It depends upon the word. So that we will see with the example, right? So osteoarthritis. So what do you mean by osteoarthritis, right? So can anyone tell me what is the root, right? Or what is prefix and suffix in this osteoarthritis? You can write down in chat box as well. In this particular word, right? Osteo is a prefix. I told you it is not necessary that there will be only one root. It might be a different root as well. Its is a suffix. Little bit nearby. Yes, root, arthritis. Yes, thank you, honey, Patel. Yes. So again, I'll explain you like arthra means joint, osteo means bone, and itis means inflammation, right? So here there is two words, right? It is called as a root. As I told you in this slide, that is, it is not necessary that only medical terms maybe have only one root. It might be two roots as well. In the example, right? In this example, we have two roots. Osteo means bone, arthro means joint, and itis means inflammation. And that's why it is called as osteoarthritis, right? But here you can see osteo, O-S-T-E, and here is an O-S-T-E-O. So O is nothing but what? It's a combining word, right? So that you can select from the combining form like vowels, right? Itis, whichever the word end with the itis, it is called as an inflammation. Any condition which is related to the inflammation, there is always end with the suffix called itis. I means S means inflammation. For example, rather than osteoarthritis, I use the word like bursitis. Bursa is a structure which is related to the soft tissue. And itis means inflammation. Inflammation in bursa, it is called as bursitis, right? And again, similar word is osteoarthritis. And again, this is very common terminology, right? That you can understand. Now, when the suffix like chronology, right? That told you in terminology. Logy by means study of, like study of anything which is very specific is called as logy. Physiology, right? Then there are many logies like psychology, right? So a study of psycho or psychiatric condition, it's called as a psychology, right? So logy by means study of specific subjects or specific things, it's called as a logy. Now, if we just use the root word like neuro, right? Neuro, that meaning related to the nerves or the nervous system, which is in our body, right? If we just learn or the study of nervous system, it is called as a neurology, right? So here you can understand here, this is a root word. Neuro is a root word. This is O, right? It is a vowel that is in a combining form, and logy is nothing but the suffix that change the meaning of that particular. If I use this only word like neuro, it is called as a nervous or the nervous system, right? But if I'm adding the logy behind the neuro, it is changing the whole meaning of that word, right? So now, if I only use a nerve, that means, or the new, that means a nerves or the nervous system. But if I'm adding the logy behind that word, it's called as a neurology. And the neurology meaning is a study of nervous system, right? Hope you understand. If you understand, just write in your chat box yes. Yes, thank you. Okay, now the second word again, if you see the neuritis, right? So neuritis. So here we use same root word, but we change the suffix, right? So here the terminology is changed, right? Neuro by means what? Nervous system or the nerves. And itis means inflammation. So inflammation of nerve is called as a neuritis. So in medical terminology, you need to just understand what exactly meaning of that root, right? If that root is added with some suffix, it change your terminology, right? So that's why it is called as a terminology, the study of different words. It's called as a terminology. And similar in that, just you need to understand what are the prefix, suffix, and roots, right? So if you understand these three components of any word, you can translate or understand the meaning of that word, right? So for example, biology, right? So bio is related to something, and logy is a study of that particular phase. It's called as a biology. Psychology, psychiatric or the psycho-related things, and if you study of those psychiatric condition or psycho-related condition, it is called as a psychology, right? And now, can anyone tell me similar words which you understand and just type in the chat box along with the understanding of that, or you can directly speak, no issue in that. Any words? I appreciate if you write down in a chat box. Cardiologist, yes. Oncologist, yes. Riya Pandya, thank you so much. Now, can you tell me? Can you open like on your mic and describe this cardiology or oncology with the prefix, root, and suffix? Riya Pandya.
Yes.
I appreciate if you like more on discussion rather than just listening one-way communication, right? Yes, Riya.
Suffix is oncologist and prefix is cardio. Cardio means heart, someone who studies the heart. And
Okay.
oncologist, I'm not sure properly, but
Onco, yes. Right. Again, you tried very nicely, but the cardio is a main word, right? Cardio is a main word. So it is called as a root, right? Logist by means study of specific, right? Those who are study related to the cardiac, it is called as a cardiologist. Study which is related to the onco is nothing but the cancer, right? Study which is related to the cancer, it is called as an oncologist, right? Or a practicing of cardiac related is called as a cardiologist. Logist by means a practicing of something, right? Here you can use a word rather than cardiologist, right? Cardiology. Logy by means, as I told you in a class, right now it's a study of cardiac related things. Oncology, a study of cancer. Yes, Trisha, yeah, you wrote like, Zoologist, yes. What do you mean by that? Trisha? Trisha, are you there? Okay. Zoologist by means nothing. Study or practicing related to the animals, right? Okay. Now we'll move forward. Okay. So there are certain rules that we have to inculcate when we are using the combining vowels, right? So the combining words or the vowels is always between the roots and the suffix, right? It's a connectivity of two different words like osteoarthritis, osteo, right? And O, it's a combining which is related or joining the osteo and arthra, right? A bone and the joint, the combining is an O. If the suffix begins with the vowels, right? Do not use the combining vowels. It's gonna arthritis, right? Not arthritis, right? Then in that condition, you are not supposed to use O, right? A simple things, if your suffix is begin with the vowel A, E, I, O, U, then you are not supposed to use the combining vowels. If the suffix begin with the constant, use the combining vowel like arthroscopy. Here we need to use O, right? Because it starts with the S. Scopy. Scopy means finding something new, right? It is called as a scopy, right? Arthroscopy, right? So arthro means joint and something find out from the joint, it's called as an arthroscopy. This is a simple rules that we need to use during the time of making the word or understanding the word, right? Next, there are certain examples, right? So cardiogram, right? So you can understand very nicely, right? So cardio is in a word root. It is in a main word, cardio, right? After cardio, right, you can use any word. It will change the meaning of the cardio. Cardio means a heart, right? Or a heart related things. But if you add the gram, right? Here the suffix is in a gram, E-R-A-M, right? Gram by means recording of something. Cardiogram, right? Recording of heart function. It's called as a cardiogram. But you can see the D is not an vowel, which is start with a suffix, right? So that's why you need to use vowels combining the two words like this, your cardio and gram, right? And prefix, right? Here still the cardium, right? Or a cardium is again nothing but around the heart, right? Or peri. Peri means surrounding. Still, the cardiac is the same word which is related to the heart. But if you add the prefix just before the cardiac, right, it's change the meaning. Peri. Peri by means around the heart. It is called as a pericardium. And the simple meaning of pericardium, that is around the heart. Suffix, right? So itis means inflammation, cardiitis, inflammation of the heart, right? As we discussed previously, like osteoarthritis, inflammation of joints and bone, it's called as an osteoarthritis. Neuritis, right? Inflammation of nervous system or the nerves, it's called as a neuritis. Cardiitis, it's called as an inflammation of the heart, right? Same as bursitis, and there are many itis in our body, right? So itis by means inflammation of that particular stuff, it's called as a suffix, right? So itis is your suffix and it is always attached on the end of the word, right? Combining forms, right? As I told you in previous example, that combining form might be 2, 1, and likewise depend upon the word, right? Here it is called as a main word cardio. Myo means muscles and the pathy means condition. Right? So cardiomyopathy, the condition which is related to the muscle heart. Right? So cardio by means heart, my means muscles, and the pathy means disease. Cardiomyopathy, it is called as a whole word, right? So you can easily see this is a main word. Again, this is main word and this is a suffix, right? So suffix is change the meaning, right? Even the prefix is going to change the meaning, right? Now, can anyone give me an example with the prefix adding with the root word? Prefix. Example with the prefix and the word root. Write down in chat box. Prefix along with the word root. We change the meaning of that root if we add just before the word root. Any word which is related. Okay, you have to give example of anything which is related to the prefix and the word root. Prefix with the word root. Are you able to understand what I'm saying? You have to give me one example which is related to the prefix and the word root. Okay, I'll give you an example, but you have to tell me which is word and which is prefix. For example, pre-operative. Pre-operative. Now you have to tell me the which is word and which is prefix. Pre-operative.
Pre is a prefix.
Sorry, can you speak loudly?
Pre is a prefix.
Is a prefix, correct? And operative is a root word, correct? Thank you, Archie, Netra. Okay. So operative by means certain things we need to operate, right? But before operation, for example, this word generally we use during the time before the time of surgery, right? For example, if somebody is planning for surgery, but there are certain tests that we have to perform pre-operative, right? So they use the word pre-operative. Pre means before and operative by means before the surgery, right? And it is called as a pre-operative. Similar post-operative. Post by means after surgery. It is called as a post-operative, like pre-operative, post-operative, right? Okay. Many times even we use before meal, after meal. That means before your lunch or dinner or after your lunch and dinner, right? So that before and after is also a part of your prefix, right? And meal is your like either lunch or your dinner. It's called as a root word, right? Okay. Okay. So prefix and suffix are related to the many things like direction, right? Direction by means generally medical we use different direction like superior, that means upper side, inferior, that means downward side, lateral, medial, and likewise. So this is what called direction. So if you just add this direction before any root, right, or before anything, it will change the meaning of that word root, right? Even the color, right? There are many various different colors names that we generally use, right, in our medical terms. Then numbers as well, right? Numbers, for example, quadriceps is in a muscles, right? Now what do you mean by quadri? Quadri is in a number like 4, right? Quadriceps, right? The muscle which is related with the 4 fibers, it is called as a quadriceps. So quadriceps have the 4 different muscles fibers, right? So even that is related to the number as well. Now one more word, biceps. Generally we have a biceps muscle, right? So by means 2, right? And ceps, right? The muscles have a 2 head, it's called as a biceps. Similar triceps, tri, right? It's a 3. So there are many words which is related with the number as well, right? Okay, then the size, again, small, medium, and large size, like similar in that the size also we can add before and after the word root, so it's change the meaning as well. And the condition, as I told you in a previously, that itis is a condition, inflammation of the things. Clear? Okay, there are other different terms, like you need to pronounce properly, right? Certain words. For example, psychiatrics. Can anyone tell me the spelling of psychiatry? Spelling of psychiatric? You can write down in chat box as well. Psychiatric, psychology. What is the spelling of psychology? Yes. Psychiatrist, yes. But it starts with a P, right? It starts with a pre. So your pronunciation of that word be very clear as per the rules, right? You are not supposed to use, right, as per the wording, but you are supposed to use the pronunciation as per the required. Then again, there are certain symbols, right? Symbols are commonly used in the case or the history as in a form of shorthand, right? So if you want to reduce your time to write down all the stuff, right, you can use the symbols as well. For example, you can use L to indicate the left, right? You can use the R to indicate the right, right? So for example, a person have a right side surgery, so rather than writing the RIGHT, right, you can just write RT, or you can just write an R. That will be enough to understand from the medical terminology side. Even you can use the symbols like this arrow, right? It is indicate the upper side, it is even indicate the lower side, or it is indicate the increase or indicate the decrease as well, right? So again, you need to use the appropriate symbols to reduce the amount of your time and the efficiency in medical terminology, right? Now, can anyone tell me what is the meaning of this symbol? First and
First,
second?
first is a male symbol and second is a female symbol.
Excellent, right? This symbol understanding you need to, right, remember when you translate that sentence, right? For example, a 45-year male. So rather than I'm writing the MALE, I'll just use this symbol. So it will indicate clearly about the male and female. Clear? So I'm clear till now? Yes?
Sure.
Yeah.
Yes.
Okay. Abbreviation. Abbreviation is nothing but the short form of any word or the phrase, right? Again, it's likely a symbol, right? Abbreviation can be save time, right? So rather than writing the whole sentence or the word, you can use some abbreviation. But yes, abbreviation should be worldwide accepted. You're not supposed to use your own abbreviation, right? For example, Hemal Patel. So I'm not using HP because again, HP is a company from laptop side, right? So again, I'm not supposed to use those abbreviation, right? So they can also cause the confusion if they are not used universally understood, right? So these are the certain like abbreviation and it's a full form. Like it's AIDS, but its full form is acquired immune deficiency syndrome. Then ECG, electrocardiogram. CT is a computerized tomography, WBC, white blood cell. So we all understand WBC, CT, ECG, AIDS, and likewise, right? And these all abbreviations are worldwide accepted abbreviations. Yeah? Yes, there are certain abbreviations, things like commonly used to save the time can be confusing if you are not using worldwide accepted things. Like for example, what is the meaning of MMT? MMT? Make my trip, right? It is not a medical terminology. In medical, MMT is nothing but manual muscle testing, right? Manual muscle testing is called as an MMT. So if you use this MMT word, right, in medically, right, it is a clear-cut indication of manual muscle testing, right? It's not a make my trip, right? If you are concerned about the confusing, spell out properly, right? Do not use your own or a personal abbreviation. Like these are the some example like ECG, echo, PT, like physiotherapy, left, right, manual muscle testing, MFR, muscle mobilization, movement with mobilization, and like many words, right? We generally use in a medical, WBC, RBC, and likewise. Okay, here are the some examples. Right, so you can see the biology. Bio is in a word root, and the logy is a study of bio. It's called as a biology, like hypertension, right? So hyper, right, or hypo. There are two different words. Hyper means high, hypo, right? It's a low. Tension is still the word, but if you change the hyper or hypo, it's change the meaning, right? Hypertension, hypotension, right? Then nephrology, gastrologist or gastrologist. Then likewise there are many words like preoperative, post-operative, like post-traumatic, right, and likewise. There are certain words that is related to the anatomical positions, right? So this is again a fundamental anatomical positions, right? So you need to understand what you mean by anatomical position. So if any person is standing erect, facing forwards, arm parallel, toes outward, and on toes pointed outward, it is called as an anatomical position. Now, if I want to explain that a person is standing in an erect position, forward, facing forward, arm parallel, toes pointed forward. For other things, writing all these things, I'm just writing anatomical position, so it will save my time. Here are the different positions, and each positions have a specific meaning in medically. Like this is called as an position, right? This is called bridge position, knee to chest position. Again, this is called knee to chest position, sideline, stool posture, and likewise, right? So even the position have a different meaning, right? And that is very specific related to the medically only. Common elements, like when you can use these words or prefix, like so for preparing a notes note, like on a physician progression note, consultation of reports, like announcing the report, operative reports, right, or the any anesthetic reports, and this all reports are not, you can find out these wordings and the short forms, abbreviations, or the symbols, and likewise, right? So whenever you read, right, notes or the reports, make sure that you need to translate those symbols, abbreviation, and the word very appropriately. Right? Okay. This is not for you. Okay. One, depend upon the area, right? We have a specific words. Like, for example, if it is near to the umbilical, it's called as an umbilical region, right? If it is left side to the umbilical region, it is called as a left lumbar region, right lumbar region. So if you find out right lumbar region in the operative notes, that means an area which is very specific, right? So in medical terminology, area is also very specific with the region as well, right? Left hypochondrial region, right hypochondrial region, right? Epigastric region. So this area is called as an epigastric. Any insertion or any trauma, right? They use this type of word to indicate the area of the body part as well, right? And again, this is again related to the anterior or the posterior, right? If it is an anteriorly, so it is called as a ventral cavity. If it is posterior, it is called as a dorsal cavity. The cavity is nothing but the surface. So the word is dorsal and the ventral. Ventral means front side, dorsal means back side, right? Even we have a very specific like thoracic cavity, right, which is related to the thoracic or the chest region. Abdominal cavity, pelvic cavity. Now the cavity is a main word. Here the word pelvic change the meaning. The pelvic cavity, that means surface or the structure related to the pelvic region only. The abdominal cavity by means structure which is related to the abdominal only, and thoracic cavity by means a structure which is related to the thoracic region, right? Similar in way, even in spine, cervical spine, thoracic spine, and lumbar. So it is very specific reason. So even the reason indicate, right, very specifically in medical terminology. Similar in nature, even frontal plane or the transverse plane or the sagittal plane have the different meaning. Transverse plane by means or horizontal plane by means a body is divided into upward and the downward side. Then this again frontal by means the body is divided on a anterior and posterior side, and the sagittal plane by means body is divided on the medial and the lateral or right and left side. So this all terminology will help to understand the translation of the whole paragraph or the sentence. Again, as I told you, the anterior is ventral, posterior is your dorsal, and likewise this is medial, which is related to your center part. It is called as a medial. Away from the central line, it is called as a lateral. Superior, inferior, that means superior by means toward the head side, inferior by means toward the foot side. Again, it is called as a caudal, right? So these are the different words that we generally use in the medical terminology. Again, for example, this is a center point. So proximal is near to the joint. Distal means away from the joint, right? Distal to the elbow. Distal to the elbow by means this word. But distal or proximal to the elbow, that means near to the elbow joint. So again, that all wordings are very much important to understand the medical terminology. Right? Okay. Any questions till now? Any question, any doubt, any query related to the medical terminology? Why we need to learn medical terminology? What is the importance of medical terminology? Then what are the component of medical terminology like prefix, suffix, mean word root, combining form, abbreviations, symbols, direction, colors, numbers? All these are important to understand medical terminology. Any doubt, any question from your side? I am happy to give you all the explanations.
Okay, thank you so much, sir, for such an informative session. Anyone has any queries? Okay, it was really amazing session, sir. Thank you so much. So we can leave right now.
Yes. Thank you all for listening and understanding.